In this demonstration, we will be explaining Rubberdam application step by step in posterior, anterior and multiple tooth isolation cases. So before we start, Rubberdam isolation is essential for moisture control, improved visibility, protection of the patient from aspiration or ingestion, prevention of contamination during restorative and endodontic procedures, better longevity of the treatment. Now let's understand the armamentarium and the components of the Rubberdam. So the first is Rubberdam sheet. The Rubberdam sheet is the primary isolating material. It can be latex or non-latex. In allergic patients it is used. Thickness options include thin, medium, thick and extra thick. Thin sheets are easier to pass through thick contacts. Thick sheets provide better soft tissue retraction and superior cervical inversion. The Rubberdam sheet has two surfaces, the glossy and the dull. The dull surface is always kept upwards towards the operator to avoid any light reflection. The next is Rubberdam frame. The frame stretches and stabilizes the sheet outside the mouth. Metal frames are rigid and autoclavable. Plastic frames are radiolucent and useful when radiographs are required without removing the isolation. The next components are the Rubberdam clamps. Clamps anchor the Rubberdam to the tooth. The parts include jaws, bows, bow arms and forceps hole. Clamps may be winged or wingless. Select clamp according to tooth morphology. Always check stability on the tooth before final placement and ensure it engages below the height of the contour. The next is the Rubberdam template. The template helps in marking the correct tooth positions. Proper spacing prevents excessive tension and tearing. So the Rubberdam sheet is kept on the template and with the help of a marker, the tooth that is need to be isolated is marked. The next is the Rubberdam punch. So the punch creates clean round holes. We can select the size of the punch. The smaller holes can be used for anterior teeth, medium for the premolars and larger for the molars. The marked sheet is kept in between and then the punch is made. Improper punching may cause tearing during placement. The next are the Rubberdam forceps. So forceps are used to expand and safely place the clamp. Ensure firm grip and controlled release to avoid clamp slippage. Additional things that are used are dental floss, which is used for safety ligature, passing through contacts and aiding inversion. A plastic filling instrument may also be used, which is used to gently tuck and invert the sheet cervically to create a proper seal. Wedges and widgets are used to improve the cervical seal. So this is the first procedure where we will be isolating a posterior tooth. So for this, the Rubberdam sheet is placed onto the template. An appropriate hole mark is made on the sheet with the help of a marker, and now a larger size punch is made onto the sheet. It is important to remember that an appropriate molar clamp should be selected. At times, it is also important to tie floss and check the stability on the tooth. The clamp is placed using the forceps. Ensure it is stable and properly seated below the height of contour. Before placing the sheet should always be stretched so as to avoid any tearing. In this procedure, we are first placing the clamp onto the tooth and then the sheet. So it is important that the sheet should be placed very gently so as to avoid the tearing. A plastic instrument can be used to make sure that the sheet is pushed below the contact points and carefully over through the clamp. If a sharp instrument is used, it may tear the sheet. Once the sheet has been placed, it should be stretched gently. Plastic filling instrument is used to achieve cervical inversion. After this, floss is used to make sure that the Rubberdam sheet is pushed below the contact area and to secure it cervically. Once this is done, check for leakage and ensure proper seal before starting the procedure. Once we are satisfied with the placement of the Rubberdam sheet, the Rubberdam frame is then placed. Moving on to the next technique, here we will be demonstrating anterior isolation, that is a central incisor. So again, the Rubberdam sheet is placed onto the Rubberdam template. Appropriate marking is made with the help of a marker and the hole is punched of a smaller size. Here we can see that we have selected a winged clamp. So here we are demonstrating the technique wherein the clamp and the Rubberdam sheet assembly is placed together onto the tooth. So the wings of the Rubberdam are used to engage the Rubberdam sheet, and then the entire assembly is together placed onto the tooth. While placing the clamp, make sure that it is stable. In general, the winged clamps are used when the sheet and the clamp assembly is placed together, and wingless clamps are used when the assembly is placed separately. After seating the clamp, stretch the Rubberdam sheet gently to make sure that it is pushed through and slides through the contact areas and cervically. When satisfied with the placement of the Rubberdam sheet, again the Rubberdam frame is taken and the sheet is secured for proper visibility. Once that is done, check for any spillage. The next technique demonstration is isolating multiple teeth. Here we will be isolating from premolar to premolar, that is from 1-4 to 2-4. So again, we place the Rubberdam sheet onto the Rubberdam template. Mark the holes with the help of a marker from 1-4 to 2-4. For anteriors, we make smaller holes, and for premolar, we can punch the medium hole. Make sure the holes are properly punched and clean, otherwise during the placement, it may get teared. Then we select the appropriate clamps. Here we have taken the winged 2A clamps. So we place the clamps on both the premolars, that is on 1-4 and 2-4. Then we start with the placement of the Rubberdam sheet. Remember to always stretch the Rubberdam sheet before placing it so that it doesn't get tear. Start with the placement of the sheet onto the one side of the premolar. Gently pass it through the clamp. Use a plastic filling instrument to make sure that the Rubberdam sheet passes through the clamp and pushed below the contact area of the adjacent tooth. Once the Rubberdam sheet is placed on one side of the premolar, we push it and pass it through the other clamp on the other quadrant premolar. This is a very crucial stage. The Rubberdam sheet should be very gently stretched. Again, use a plastic filling instrument to gently pass it through the clamp and the contact area of the adjacent tooth. Once the Rubberdam sheet is passed through both the premolars, we pass the Rubberdam sheet through the anteriors. As we can see that once it is secured on the either side, it easily passes through the anteriors. The sheet is gently passed through the contact areas of all the teeth. Once again, we use floss to push the sheet cervically and below the contact areas. So we take floss and we pass it between all the teeth through the contact area. Once that is done, we take the plastic filling instrument and invert the Rubberdam sheet cervically. Failure to invert leads to saliva leakage. It is also always important to remember that incorrect clamp selection can lead to instability or improper hole spacing causes excessive tension and may result in tearing. So we should always use a template. A sheet should never be forced through tight contacts.